So our UCL Doctorates in Business Administration Health is a professional doctorates, and it's really targeted for people who are looking to get the research skills and knowledge you get in a PhD. It is equivalent to a PhD, but under a part-time basis that allows them the flexibility to be in full-time work while they're undertaking this doctorates. Now, just in terms of housekeeping rules, you'll see at the bottom of your screen, there's a Q&A function. So if at any point during this presentation you have any questions, you can just put them there and I'll address them at the end. So first of all, who are we? Well, the Global Business School for Health was set up a year ago, actually, almost to date. We're the first business school totally dedicated to health and healthcare. And the reason that we are at UCL in such an important department is because healthcare is probably one of the most dynamic, changing sectors in the world. Also, what we see today is that healthcare takes up more of our GDP. It is a product of multiple factors. One, of course, demographic change that we see happening around the world, particularly here in the Europe with the aging population, but also increases in non-communicable diseases like cardiovascular disease and diabetes that is impacting people globally. So in many developing and low-income countries, we see as much as 70% of early deaths contributed to non-communicable diseases. So put all this together and then add a pandemic, and you can just see how important the work in the healthcare management space is today. So number of organizations are thinking about workforce, leadership, the use of technology, different types of technology, digital health, and moreover, how they work. Pharmaceutical companies are rethinking what they do and how they work and behave. All of this is coming together to create a new kind of health economy and health system globally with lots of different stakeholders and mandates. So the need for research at the PhD level, at the doctoral level, is never been more important. And some of the people that are best placed to drive that applied research are people who are already professionals working and are looking to really couple what they're doing in the workplace with the skills and knowledge to really take research at the kind of the level that can really be impactful for health and healthcare. So as the first global business school for health at UCL, which is of course a powerhouse in the medical sciences, health sciences, life sciences area, no better place to undertake a professional doctorates. And then also recognizing that business and management as an area and a discipline, coupled with its focus on best practices and really applied research, makes a powerful place to really undertake this degree. So what do we hope you will gain through this is really applied research skills, as I mentioned, that can be really utilized in your workplace, in the healthcare sector. And for you personally to really get a heightened awareness of how to undertake research projects in the healthcare space. Really develop your confidence, accelerate hopefully your career, or evidence much of what you've already done in a way that really adds an evidence base for decision making in the healthcare sphere. So we are really varied, and as a school, we have a real interdisciplinary team made up of people across the health ecosystem. So that covers biotech and pharmaceutical management, digital health, also global healthcare management, but from lots of different lenses, focusing on the kind of finances of healthcare, health economics, health policy. And then we've got people who are focusing on the consumerization of healthcare, particularly from a patient-centered approach. So these all really feed into thinking more widely about health systems and health system strengthening as a key focus for the work we do at the Global Business School for Health. So some of the highlights about this program. So for those of you who may not know, professional doctorates are really about undertaking the same rigor and work that you'd get in a PhD, but much more in this kind of applied research space. So this program has been specifically designed for people who are professionals, who need flexibility, who are working full-time in senior health leadership roles or as managers. So the PhD or the DBA, sorry, really unfolds in three parts. You have, in the first 2 years, you'll take a taught element. It's by distance learning. The program is actually by distance learning. And again, it gives you an avenue to get a doctorate at UCL through distance learning. And so the first 2 years, each term, so across term 1, 2, and 3, you would have a module that focuses on developing your research skills. So for example, the first module you'll take is really be an overview, but also give you the skills of really doing a critical literature review in that applied research area of healthcare management. Then you'll move on to learn more about research design, quantitative, qualitative techniques and methods for analyzing your research. Of course, also, how to really write up your research, to publish your academic writing skills. There's a module on co-producing with patients. So the program is really designed, and there's an optional module as well, where you can either do a module in digital health, or you can do one in systems thinking for healthcare. So the first 2 years there are really focused on giving you the backgrounds, the toolkit to undertake doctoral research. Then in the third year, we have you do a more reflective piece. You don't take any more modules, but you'll be assigned a supervisor. You will have, by the end of your second year, produced a research proposal that will be agreed by a committee. And you will also, if you're doing any kind of primary research, will have gotten your ethics approval. So in that third year, in addition to starting those early days on your dissertation, you'll also produce a professional practice portfolio, which is really a reflective piece that allows you to think more conceptually about the work you've done and research more generally in the space that you'll be taking forward. And then finally, your last 2 years will be dedicated to working with your supervisory team, which will have a primary and secondary supervisor to produce that substantive piece of applied research in this space. So it's a real intensive program, but it gives you the opportunity to fit it around your work. And other than those 1 week residentials each term. And those dates will be published soon, so you can factor those in and hopefully set those aside for your workplace. Now, one of the things that I want to mention to you is, we have, as I said, a real interdisciplinary group of scholars. So although your professional doctorates is in, healthcare management or health management, you have the opportunity to work with a variety of different individuals. So you can really take your personal interests and kind of expertise forward, whether it's a discipline in medicine, health, or life sciences. And these are all areas that UCL exceeds at. So, in terms of the recent research excellence framework exercise held in the UK, UCL was second for its research power, and lots of that was connected to our impact. Also, moreover, UCL is known for its, population health science research, and currently is ranked 10th, and in the top 10 in the Shanghai rankings for global health. So we really have experts and people that you can tap into who will guide you to really develop a substantive piece of work that will help you not only get the degree, but really accelerate your career and be something that will add to your skill set for the future. Now, I've mentioned just the structure of the program and a little more about some of the modules. And as I said, the program is specifically designed for aspiring healthcare leaders who want to get that research expertise that will help them in their workplace. And as we all know, more and more decisions are made from an evidence base. So whether or not you're in a role where you're going to use that research, or whether you're going to be in a management or leadership role, we're having that understanding and gone through this professional doctorates, you can help to question, make more better decisions, will be very important. It's also an opportunity to network with like-minded individuals, to get an opportunity to attend conferences, present papers, to really polish your skills in this area of developing research and literature. So who are our typical students that we're looking for? Well, this is a brand new program. So our 23-24 intake will be our inaugural class, but we're really hoping to attract health professionals wanting to gain applied research background to drive forward, as I said, an evidence-based approach. So ideally, you'd be in a senior staff position, either wanting to refresh your skills or develop your skills. You might be on a career break or looking to pivot your career somewhat. You might already have an MBA or a master's and looking for an academic challenge. All of these are the right reasons and the right individuals to take this program. So the DBA Health program really is a unique offering. DBAs exist in a number of business schools. It is an online, mostly distance learning program, other than the kind of 1-week residentials that I mentioned. If you're an overseas student, you would be expected to attend those. So you would need to come to the UK for that. If you're, and of course, all the students, that's a mandatory component of the program. So the program starts in September 23 with an induction. It's a 5-year part-time program. As I've now said numerous times, it's a distance learning with termly 1-week in-person education here in London. The applications are currently open, and the cost over the 5 years totals $64,000, and it's broken down into years 1 to 3 at $16,000, and then years 4 and 5 at $8,000. So and as I said, it's a part-time distance learning program. I've gone through the structure, so but again, the 2 years at the beginning are really around those top modules. You get 120 credits. If for some reason, by the way, you were unable to continue on to the thesis, you can, if you've completed those 120 credits, exit the program with a postgraduate diploma in research skills for business administration and health. And then in part 2, you would prepare this professional practice portfolio that I've mentioned, which is really a reflective assignment of 5,000-word essay encompassing your readings, your critical analysis, and that professional reflection. And then part 3 is your 45,000-word doctoral thesis for your final part of this award. The admissions and what we're looking for, of course, ideally you would have a master's or an MBA degree. and, or an overseas equivalent, we will look at people with extensive relevant work experience, and they can apply, and we can consider those individuals on an individual basis. You will need, if you're coming from overseas, an IELTS score of a level 7 or above with no area below a 6.5. You should ideally already be in the health sector, or have some previous experience outside health. We will look at that. We will consider people who want to pivot into health, but ideally you would already be in the health or healthcare sector in some area. Our applications are open now and they close on the 31st of March. You do have to have work experience of 5 years or more. Ideally, you'd want to have more, because that work experience will be very important for helping to inform your work, your thinking, and also your interaction with colleagues in your cohort. You will have to have an interview that will take place prior to being accepted on the program, a personal statement, of course, a CV, and 2 references. So there's quite a few different pieces that you're going to need to put together to apply for this program. Just to give you a taste of some of the individuals that might and areas that you might want to consider, there's myself, of course, and for people who are interested in questions around health policy and practice, particularly financial areas, and also leadership and innovation are areas that I'd be keen to work with you. And again, you don't have to, it's not like a PhD. You will develop your thinking and your research proposal while you're in the program. So you can look at our supervisors, and of course you'll see that there really are interdisciplinary and cross a number of areas, but you don't have to make the critical decision at the beginning. You can make it as you go through those first 2 taught years. Another example of one of our staff member is Dr. Rodolfo Cantina, who is a lecturer in operations and supply chain management. And then Sanela Tomini, who also is a lecturer in health economics. So again, healthcare financing, economic analysis, global health, and human well-being. These are just some other supervisors. And again, we have a page on our website. You can find it where all of these individuals have a little more about themselves and the topics they're interested in supervising. And then lastly, I just wanted to mention to you, we've got other open days for our MSCs. If you're, thinking that this may not be the right program for you, you can apply for them. So that's really it for my presentation. And I can see I've got a couple questions, so I'm going to stop sharing my screen and move to the questions. So the first one, although I work within the health sector, I am a procurement and supply chain professional. Is that suitable for me? Yeah, absolutely. And as you just saw, Rodolfo Cantina works in that same area. And so supply chain would definitely be an area that you could do your thesis on. What is the course code for this program? I can only find the research degrees on the application. So thank you. That's a really good question. I believe that they haven't got that up on the portal yet. So if you could just bear with us, we are hoping that that will be any day now, and we will send out an announcement on our social media. So if you just can get all of your materials ready in the meantime, we would be happy as soon as that portal's open to let you know. Okay, well, I see only 2 questions. Is there any other questions? Anything I can help you with as you consider this program? I work in private sector, CRO, in research. Would you consider that healthcare? Yeah, as I said, Jay, it doesn't have to be a hard healthcare, healthcare more broadly. And of course, one of the ethos as a school is really bridging that public-private divide. that we often see in the kind of health ecosystem, helping people. So yes, I think, you know, it's a broad definition in terms of the students. And we just want to make sure really that they're people who are, you know, interested in healthcare. Can the course be considered into 4 years? Yes, it can actually. You know, and given the idea that, you know, it's really 4 to 5 years. So I would expect that there may be, you know, a number of people who can condense it and finish that thesis. So once you finish the 2 taught years, got through that reflective piece, you know, and those working on your dissertation at that point through that 3rd and 4th year, there's no reason why I wouldn't expect most people to be able to finish it in 4 years. But UCL likes to give people 5 years. So that's definitely doable. Okay, any other questions? I'm just going to hang on one more minute. If not, as I said, we will get that portal opened up, you know, hopefully in the next day. Another question, William. What is the actual name of the degree awarded? So you will have your thesis, of course, but you know, it's the whole idea here is that you're getting this professional doctorate. So you will your degree title, and I just want to make sure I get it correct. So if you do this program, you will have a doctorate in business administration health. And that will be the exact title. So it's a DBA Health. And then, of course, you would have whatever your thesis is, you know, alongside there. Okay, any other questions? The link to the application portal. Yes, I am going to ensure when I get off this call that we get that link sorted out so that everyone can start to apply. I do apologize, but as it's a new program, there's been some time delay. Sorry if I'm asking about the MPhil PhD program. Is there anywhere in the UCL website for format for a research proposal? Yeah, if you'll actually Google UCL research proposal, you'll find a very helpful guide in how to put together a research proposal. And of course, when you're applying for your MPhil, DPhil, you're putting together a draft proposal to, as you know, part of your package there, slightly different than if you're doing this professional doctorates. But it is an integral part, and you need to reach out to those supervisors in advance to actually applying to make sure that what you're proposing and what you hope to do will align with one of them. Will we get the invite for the funding information webinar? Yes, you need to sign up for that, but I believe if once you're on this kind of mailing, you should receive that. Does UCL award a DBA non-health by any chance in case my research does not fall into healthcare? Currently, UCL does not have a DBA that's non-health, but there may be one in the future. I mean, the DBA Health is the first kind of professional doctorates in this space offered by UCL. Will your slides be shared with attendees? I believe that this, since this is being recorded, it will be placed on our YouTube channel and you can watch it from there. Just to make I find and select the right program, of course. Okay, if there are no more questions, I'll wait again, just one more moment. And by the way, you can always email us, reach out to us. We're always here. We want to support you, help you get the best application. And also, as soon as we get the portal open to accept applications, all the people that attended this webinar will get a email telling them that it's open and how to apply. So again, thank you so much for your time. And don't hesitate if you need a one-on-one to talk through any questions. That can be set up with myself. And we really hope that you will join us. Thank you so much and have a great day.